Got it.
Wonderful. Let me share my screen. Host disabled. You need, Thomas, can you enable me to share screen since I had to log in on a non-work account?
Yeah, hold on one second. All right, try it, Lance.
Thank you. Let's see. Everyone see the full screen?
You can see it.
Wonderful. Thank you, everyone, for joining us today. Obviously, this is our strategies to reduce tobacco use and obesity in 7 Southeast Oklahoma counties proposal preparation workshop. My name is Lance Thomas, and I'm your MC for the festivities, but I am certainly not the most important presenter. We will get to them here shortly. As far as housekeeping, wanted to cover just 2 or 3 things. I believe everybody starts off muted, and you have the option to unmute, but if you are not unmuted or if you are not muted, please do so until the end, and we'll let you know when you can ask when we get to the Q&A section of the webinar. If you have questions during the presentation, feel free to scroll down and find my name in the list and send them to me, or you can send them to one of our other presenters, but if you channel them through me, I'll make sure that they get asked. And then finally, and this is very important, today's presentation addresses the specific funding opportunity for the 7 counties in Southeast Oklahoma only. If you are interested in TSET's other funding opportunities, including TSET Discovery Grants, which was also released recently, those will not be the topic of discussion today. And even if you have questions about those, our encouragement is to go to the TSET website under funding opportunities, under the other funding opportunities tab, and there is a form to ask questions. And so that is how we will keep those 2 separate because they are entirely separate funding opportunities. So now that we've got those things out of the way, this is our agenda for the day. Certainly we will cover these as quickly as possible because we do want to allow plenty of time for question and answer at the end. And you can see them, so I will not go in detail for them. Are your presenters today? You have me, Lance Thomas, and I'm a Senior Health Communication Consultant at TSET. And I'm very excited about this webinar and these opportunities, and we're really pleased that you're here. Joining me today will be Jessica Davis, our Assistant Director of Programs, Tessa North, our Director of Grants Management, and Kelly Parker, also our Grants Manager in our Grants Management Department. And all 4 of us will cover different pieces and parts. And just want you to know who was talking with you today. Just a little bit about us, in case you are unfamiliar with us altogether. TSET was formed just a shade over 20 years ago after a settlement with the tobacco industry, and Oklahomans wisely chose to put those funds to good use. TSET's agency mission, obviously, we are trying to improve the quality of life of all Oklahomans by investing in accountable programs and services that address tobacco use and other health issues, including obesity. Our history, again, we were created in 2000. Our agency started up a little bit after that. We continue, the endowment was established back then, and it continues to receive money from the tobacco industry. They will pay into the endowment as long as cigarettes are legal for sale in the United States. A lot of folks don't know that. We are the only endowment of our kind, and we also receive 0 tobacco tax dollars. That is an entirely separate thing from our endowment. Ours is based only on the settlement with the tobacco industry from 1998. The bulk of our work centers around what we call 3-4-64, that there are three behaviors that cause 4 conditions that attribute 64% of deaths in Oklahoma. That's not very good, but those 3 behaviors are poor diet, sedentary lifestyle, and tobacco use. Those cause, in many instances, lung disease, cancer, heart disease, stroke, and diabetes. And although there are, of those 64% of our deaths, many of them are ones that would happen whether someone smoked or had a sedentary lifestyle or not. Many of those are premature deaths, and those are preventable, and that's why we are doing what we're doing and why we're trying to invest the way that we invest. And I think about it this way: if TSET could, if we could reduce that number in a significant way, just imagine the other wonderful things that we could fund to make Oklahoma an even better place than we're trying to make it right now. So how do we affect change across Oklahoma? We have statewide initiatives, which are very broad and try and tackle system change and other large initiatives. We have health communication interventions. Many of you have probably seen our campaigns for the helpline or Tobacco Stops With Me or Shape Your Future. We have some other new ones coming out that are out now. In addition to those, we have research grants, grants that fund large cancer research, Stevens Cancer Center, the Oklahoma Center for Stem Cell Research, a number of research grants that help improve the lives of Oklahomans. We have mechanisms for evaluation and best practice support, which is to say we evaluate everything that we do because we always want to make the most informed, data-driven decisions that we can. We have our healthy incentive grants, which many of you may be familiar with, that are available for communities and schools who achieve certain health policy outcomes. And they've used those for a variety of projects to improve local communities where people do their daily living. And we also have our Healthy Living Program grants, which is one of our sources of community-based grants. And those are spread out across the state and have countywide service areas. We have a couple of new grant types that we just went through the first process for them, but those are related to policy and built environment change, and then innovations in active living and healthy eating. So you can see a theme here. There's a lot of local work, a lot of work trying to increase the amount of physical activity people have access to and improve diets of folks in addition to our tobacco work. So why this funding opportunity? Well, we believe in that community grant work is a source of real and lasting change. Local people doing local work have the best chance for success in most instances. We are committed to maintaining grants in priority counties across our state, and the ones that we're talking about today all have higher than normal rates of obesity and tobacco use, and so we want to make sure that we're investing in those places. And then finally, we want to continue, work because this work is important to our overall goals, which I just discussed. So the goal of this funding opportunity is to build on the foundation, and others will cover this in much greater detail, but to build on the foundation that was laid by previous TSET Healthy Living Program grants, and then engage organizational partners from the previous grants for the information that was gathered during the assessment phase, and then apply those strategies to really affect some good change. With that, I'm going to hand it over for an overview of the RFP to Tessa, our Director of Grants Management, I think.
Thank you, Lance. Hi, everybody. My name is Tessa. Thank you very much for joining us today. I am going to give you an overview of some of the important information that you hopefully will see in the RFP. If you don't currently have the RFP downloaded, I would encourage you to have it. have it available so that you can ask questions at the end of the presentation today, and you can reference some of the pages that I'm going to mention as we go through these slides today. With that, Lance, could you please go to the next slide? So the first thing I want to start off by talking about who is eligible to apply for this opportunity. For this particular opportunity, private, nonprofit, 501c3 organizations are eligible, tribal nations, public agencies or entities, which would include any sort of public entity, so state, city government, universities, schools, those are all eligible to apply. For any organization to be eligible, they must have an official presence in the proposed service area. So what that means is that they must have a location in the service area that they're proposing to serve, and that location must exist prior to TSET support. So it needs to be able, we need to be able to see already that you guys have a location in your community that you're proposing to serve. Finally, one very important note for this opportunity is that the eligible applicant organization must be located in one of the following counties: Atoka, Bryan, Marshall, McCurtain, Pittsburgh, Pontotoc, or Pushmataha. So those are the counties that are eligible for services under this funding opportunity, and those are the counties where an eligible applicant organization must currently exist. Next slide, please. Sorry, I'm two different Zooms here. For eligible applicant organizations, they must have adopted and implemented a comprehensive tobacco-free policy by the time they submit their proposal. Please note that we will talk about the policy, the tobacco-free policy, in a few slides, but I want to make sure that you guys are aware up front that that is a requirement to be eligible to apply for this funding opportunity. Eligible organizations must also be in good standing with the Oklahoma Secretary of State if they're a nonprofit. And all eligible organizations must attest that they will not accept funding from the tobacco industry during the duration of their agreement with TSET. So this is another really important term, and I will point you to where you can see the language for that attestation later on in my slides. Next slide, please. So on your screen, you can see a map of the service areas that will be funded in this funding opportunity. So again, it's the 7 counties that we mentioned: Atoka, Bryan, Marshall, McCurtain, Pittsburgh, Pontotoc, and Pushmataha. Each of these counties, grantees in each of these counties will serve a hotspot region within the county. So the hotspot regions were strategically selected and defined by the former TSET grantee and the community partners in that area, using data from 2020 Wellness County profiles that were developed by the Center for Chronic Disease Prevention and Health Promotion at the Oklahoma State Department of Health, and also using census tract appendices. The hotspot regions consist of census tracts within the county that were deemed as high need due to poor health outcomes. So that's why these are the service areas that we're choosing and how the hotspots were determined. It's important to note that only one service area may be included in a proposal, and only one proposal will be awarded per service area. So if your organization has a physical presence in 2 counties, 2 of the counties under this funding opportunity, and your organization wishes to serve both of those counties, please know that those must be submitted as 2 separate proposals because only one service area can be included in a proposal. Next slide, please. So for the funding for this opportunity, the TSET Board of Directors has allocated $840,000. So individual grants of up to $120,000 annually can be offered for up to 3 years. So the funding available under this opportunity is based on the number of strategies that are selected. So you can see here on the screen, we've got 1 strategy for $30,000, 2 strategies selected for $60,000, 3 strategies can budget up to $90,000, and 4 or more strategies can request $120,000. Each of these is a annual funding amount, so you would have the opportunity to request the same amount of funding for years 2 and 3 under this funding opportunity. It's important to note that any multi-year grants that are awarded under this program are governed by individual annual agreements, and each of these individual annual agreements are eligible for renewal consideration at the end of the fiscal year. Renewed funding is always contingent upon grantee performance, funds available, and approval by the TSET Board of Directors, who makes all funding decisions. Next slide, please. Sorry, my mouse is broken. Okay, so talking about staffing here. So up to two full-time staff may work on the grant depending on the workload. But it's important to note that applicants who are seeking to work in only one strategy may not need a full-time position, and that's totally fine. Applicants that are proposing 3 or more strategies may require 1 or 2 staff. And any staff that are hired should be hired and in place, physically located behind a desk or an area at the grantee organization within 75 days of the contract start date. We will touch on the contract start date a little bit later on in the slide, but so just keep in mind that if you don't currently have staff and you are seeking to apply for this opportunity, you have 75 days to get those staff in place and ready to work. Any staff that are hired should possess knowledge of public health principles and policy systems and environmental change as it relates to obesity reduction and tobacco control efforts. We also will require that all grantees that are awarded have to ensure appropriate levels of staffing are maintained for the duration of the program. Of course, having full staffing levels ensures that all of the work can continue across the service area. We don't want to see a disruption of work at any point during the grant year. So it's very important that adequate staffing be maintained for the duration of the grant. If for whatever reason a position does become vacant at any point, the grantee has to ensure that those positions are filled within 60 days of the staff departure. There, of course, could be an exception if a staff vacancy occurs during the last 6 months of the grant, in which case you would discuss with your program officer whether the vacancy should be filled. So it's important to note that when we are talking about staff, we are talking about the direct program staff, the people who are going to be the boots on the ground, say. Additional staff, such as authorized officials, office managers, financial officers, can have a portion of their effort paid by the grant's administrative charge or indirect cost category, but they cannot appear as a distinct personnel in the personnel section of the budget. Next slide, please. So this initiative is a 3-year program. As I mentioned, each contract is comprised of 3 annual agreements that are renewable each year, of course, depending upon funds available, grantee performance, and approval by the board. During each year of the contract, grantees will undergo performance reviews, and those results are shared with our TSET, the TSET board of directors, and that's some of the information that they use to determine whether funding should be renewed for a subsequent fiscal year. So at the end of each fiscal year, as we look to renew budgets for the next year, please note that budgets are developed annually. So when you go to apply for this opportunity, you'll only be requesting year 1 of funds, and you will request year 2 or year 3 just before the start of the next fiscal year. Next slide, please. So one thing that we want to make sure all applicants for TSET funding opportunities are aware of is that all payments on TSET grants are made on a reimbursement basis. So no funds are paid up front. Further, only work that's performed under an active TSET cooperative agreement is eligible for reimbursement. So any charges that you might incur before a contract is fully executed or after the contract's end date are not eligible for reimbursement. So if you are anticipating that you are going to apply for this funding, please make sure that you do not start any work that you intend to request reimbursement from TSET for until you have an executed contract and that all the work takes place within the dates listed in that contract. It's also important to know that the TSET Board of Directors sets a goal for us as an agency to fully expend 95% of all budgeted funds by the end of a fiscal year. So each awarded grantee is assigned a grant manager who will work with you throughout the grant period to monitor spending in order to meet the agency's goal. So to ensure accurate accounting, all grantees are going to be asked to submit monthly invoices or claims for reimbursement. We use the terms interchangeably within 30 days of the last day of the previous month. So this is really important to know as a requirement of the funding. You will be required to submit invoices monthly. And we certainly understand that sometimes it takes a little bit of time to get invoices from contractors in or something like that, and that's fine. Your grant manager will work with you to make sure that you are invoicing monthly for as many of the charges as you possibly can. And then if for whatever reason charges can't be invoiced on 1 month, they can always be caught up on a subsequent month's claim for reimbursement. But it's just really important upfront that you know going in, this will be an expectation. So your financial officers or whoever manages your billing will need to be prepared to submit claims for reimbursement on a monthly basis. Next slide, please. Thank you. So prerequisite preparation and submission. For this funding opportunity, there is a prerequisite that must be met. A vital step is submitting, well, let me back up. Our goal as an agency is to reduce the rate of cancer and cardiovascular disease in Oklahoma. And so that means we want to work with organizations that have adopted and implemented comprehensive tobacco-free policies for all properties that are under the organization's control. So because of this, each potential applicant must submit a signed copy of their tobacco-free policy prior to submitting a full proposal. All submitted policies will be reviewed for adherence to guidelines of a tobacco-free policy, and these policies must meet all requirements in order for the organization to be approved to submit a full proposal. So this is a really important first step, and I'm going to talk about it a little bit more on the next slide, but I want to make sure as we first start to discuss this, that everybody is aware that it is a requirement that organizations that are interested in apply submit a comprehensive tobacco-free policy, and that policy must be submitted to TSET before 4 p.m. on May 25th. There is a link in the RFP for the submission of this policy. And once you are ready to submit your policy, please make sure that it is signed and dated and it's uploaded in a PDF format. So these are really important things to keep in mind. Next slide, please, and we will talk about what exactly goes into this policy. So because tobacco-free policy requirements vary between private nonprofits, school districts, tribal nations, and municipalities, we have included in the guidelines that are on the website sample policies and checklists that outline the required elements of a tobacco-free policy for each of the different types of organizations that may be applying. I'll direct you to Appendix B for this information, and I cannot emphasize enough how important it is to review very carefully the information in Appendix B. Applicant organization tobacco-free policies must align with the provided checklist that most closely matches their organization type. So we have checklists for cities, towns, or counties, community organizations, which would include 501c3s, higher education institutions, school districts, tribal nations or governments, and other types of work sites. So again, look at Appendix B, figure out what type of organization is most closely aligned with yours, and review the policy documents and checklists that are included for your type of organization. So as I stated on the previous slide, the tobacco-free policy must be submitted on or before 4 o'clock on May 25th, and it must meet all of the requirements in the policy checklist in order to be approved by TSET, and then subsequently be eligible for submission of a full proposal. All prereqs must be submitted as a PDF via the Smartsheet link in the RFP. Within 2 business days of submission, grants management, so myself or Kelly, will reach out to whoever is listed as the contact on the submission, and we will let you know if your policy passed the review. If the policy meets all of the requirements, again, emphasis on all of the requirements stated in the checklist in Appendix B, then you'll be provided with a link to submit your full proposal. If the policy doesn't meet all requirements, the applicant will be informed of where the deficiencies are, and you can resubmit. You can resubmit as many times as necessary, as long as up until May 25th. So please keep in mind this May 25th deadline. Nothing will be accepted after that date. If you do submit a policy on May 25th, and that's the first time that we will have reviewed it, and it does not meet the guidelines or the requirements to be considered a comprehensive tobacco-free policy, please note that that's the only opportunity. May 25th is the cutoff date. So I cannot stress enough how important it is for anybody who's interested in this opportunity to review and pay close attention to the sample policies and associated checklists located in Appendix B. I wish I had Appendix B on the screen just flashing for you guys. Please think of these policies as templates into which you can paste your organization-specific information. So all policies must contain all information that's highlighted in yellow in the sample document. If you haven't looked at the Appendix B yet, you will see that there's red text and there's text highlighted in yellow. These are there to really call out what it is that you need to pay really close attention to. So please make sure that you take a look at that. If you're using your organization's current policy, if your organization already has one in place, that's great. But it's really important that you compare your policy to the sample policy for the same type of organization and ensure that all items on the checklist are included in your policy, including the yellow highlighted items and the red font or organization-specific information. Just simple things that we have noticed in previous reviews of policies that you might want to make sure that are included in your policy include your organization's name, an official signature, and all required dates. So if the policy template says that you need an adopted date or an implemented date or a signed date or any other date, make sure that those things are in there. Those are relatively small things that seem to be overlooked quite often. So I want to make sure I call those out for you guys. Like I said, you will have the opportunity to resubmit your policy as many times as necessary before May 25th. Keep in mind the 2 business day window that we have when you are thinking about when you want to submit. We have 2 business days to respond with your results, but nothing will be accepted after May 25th. So because of the May 25th and because of the 2-day window that we have for review, I strongly encourage you to submit your policy sooner rather than later to provide for ample time for any revisions that may be necessary for the policy to meet the requirements in order to be considered a comprehensive tobacco-free policy. This is a requirement of the opportunity, so there is no wiggle room on this opportunity. So on this requirement. So please take advantage of submitting early for your prerequisite policy. And like I said, we will provide you with feedback so that you know exactly what you need to do to get your policy to be comprehensive and meet all of our requirements. Next slide, please. Application preparation. So starting on page 12 of the RFP, you can find all of the guidelines about formatting your proposal. I don't think that you will find anything too confusing or crazy in there. We do ask that you adhere to all of the guidelines that are published in the RFP. Of note, we do ask that you include the applicant organization name and the RFP number in the top right corner of each page of your narrative. We ask that you also number each section separately at the bottom right corner of the page. This helps the reviewers and helps anybody who might print off the proposal to review it in case anything gets shuffled around or whatever. We want to make sure that we can that we are reviewing your proposal in the correct order whenever it comes time to review. When it is time to submit your proposal, you will have 2 separate documents that you submit. The first one will be a compiled narrative that includes required forms and all of the documents that you have prepared offline. That is the bulk of your proposal. The second document will be your budget, and that is included on an Excel document that is attached within the RFP. So 2 documents will be uploaded for each proposal submission. Next slide, please. So page limits. Within the RFP, you will see that there are page limits indicated for each section. You do have to adhere to the page limits that are stated in the RFP. Reviewers will not read beyond those page limits. Section limits do include text, graphics, charts, and figures, although required forms are not counted toward that page limit. So if a form is listed as required in a section, please note that that will not count toward your 4-page limit or whatever it is for that section. Applications, like I said, will be reviewed only on the content included within the allowable page limits. And we are not looking for, we're not going to go on down a hyperlink rabbit hole in order to get more information out of your proposal. So please don't try to use hyperlinks to get around page limits to provide more information to reviewers. I would strongly recommend that applicants utilize as much of the page limits as necessary to thoroughly address each section of the proposal. So if a section has a page limit of 6, that 6-page limit was determined by us. We feel like that is an appropriate amount of space for you to clearly state what it is, that answer all the questions that we are looking for, give you room to fully elaborate. So it may be helpful for you as applicants to think as page limits less as limits and more as goals. So we recommend that you try to fill as much of the pages as possible with useful and direct information that will help reviewers to make an accurate assessment of your organization's ability to carry out the proposed work. You don't want reviewers to have to guess what it is that you're proposing to do or whether your organization is poised to be successful. Make sure that you use those page goals to paint a clear picture for the reviewers. And again, we encourage you to use as many of the pages as necessary to paint that picture. I think one of the common themes that we have seen in previous reviews is that reviewers would review a section that maybe utilized half of the page limit, and they're like, gosh, I really could have used a lot more information. It's important, next section, please, Lance, to remember that reviewers may know absolutely nothing about your organization or your community. So leave nothing to their imagination. They're only going to evaluate a proposal based on what is contained within the pages. So it is imperative that the applicant thoroughly addresses each section of the proposal. The other thing I'd like to note for you is that as you address the individual proposal sections, please ensure that you look at the review criteria that are on page 16 in the RFP. Starting on page 16 are the exact questions that reviewers are going to consider as they read each proposal. So providing clear, direct answers to those questions in your proposal narrative is going to be beneficial to the reviewers and ultimately to your proposal. So strongly encourage you again to bookmark page 16 of the guidelines and make sure that you are answering those questions as you are preparing each section of your proposal. Before you prepare your proposal, I also want to note a common issue that we have seen. You need to make sure that you have fully downloaded the guidelines from the TSET website and that you have accessed all of the required forms. Throughout the RFP, you will see hyperlinks to forms that are indicated as required. If it is a hyperlink, it should open up a form for you. If you click on a hyperlink and a form doesn't open, you likely do not have the document downloaded and are instead viewing it in your internet browser. So this is a common issue that we have run into with internet browsers, and I want to make sure everybody is aware of it. In the guidelines, there are a bunch of forms, like I said, that are specifically linked. So you'll see them on both the left-hand side of your screen if you have the downloaded document open in an Adobe version, and you will also be able to click those hyperlinks and the forms would open too. So really want to make sure that everybody's aware of this. If you have any problems with forms not opening and you think you aren't sure if you have the document downloaded, reach out to me or to Kelly and we are happy to help you with that. It is, like I said, a common issue. So I just want to make sure everybody is aware of it. Before compiling your proposal, I do strongly suggest that you print off Appendix D, which is the application submission checklist, and ensure that you have every form that is listed on that checklist ready to be filled out. If you can't access the forms, again, let me and Kelly know. We are happy to help you. Please let us know sooner rather than later. So honestly, when you get off this call today or maybe over the weekend, I would suggest going into your RFP and making sure that it is downloaded and you can fully access everything so that you can get ahead of any issues that might have arisen or that might arise if you're opening it in your browser. So listed here on the screen are the main sections that are required for each proposal. I'm just going to hit some highlights for each of them and you will find more details in the RFP itself. So please make sure that you review these before you start preparing anything. The first required form is attachment A, which is the cover page. This is a form, again, that TSET has created, is included in the RFP. So it is required. It includes general information about each proposal. So it'll be the cover sheet for your proposal. So please make sure that you have downloaded that. The next section will be your table of contents. Again, this is for reviewers' ease. It'll help them quickly navigate between different sections or find specific information they're looking for. And then after those first two sections, we get into the real meat of the proposal here. So you have 5 different sections for your proposal where the reviewers are really going to figure out what it is that you're trying to do and whether your organization is poised to complete the work. So the first section of the proposal narrative is for your organization's background and qualifications. And here's where you're going to tell us a little bit about your organization and why it is that you are the right organization to carry out this work in this service area. In this section, you'll want to make sure that you provide information about services, programs, or policy efforts at your organization that are directly related to the proposed strategies so that you can create that link for the reviewer so they see why it is that you are already in a great place to continue this work. If you have subcontractors that you're going to be utilizing, you would talk about them in this section, detailing what it is that they're going to be doing and why they're qualified to do so. The next section is the hotspot region, population of focus, and demographic data for your service area. And this is where you're going to describe the area where the strategies are going to take place and the population to be served. So in this section, you're going to want to include demographic data and health issues that do affect the population. Important thing to note is that you are going to be asked to describe any barriers that might exist to serving that population. And if barriers do exist, it's important that you tell the reviewers how you're going to address those barriers. So that's an important thing that we have seen perhaps as an area for improvement in previous proposals, not only identifying barriers, but addressing how you're going to overcome them. If you do any data that you use, please cite it. The reviewers will want to know where you came up with the data that it is that you're using in your proposal. Section C of the proposal narrative are the strategies to be implemented. This is where you'll provide an overview of each proposed strategy that you're seeking to be funded. And you're going to talk about what makes your organization a good fit to implement the strategies. You're going to have to describe the organization's experience in engaging key stakeholders or partners that will be necessary to successfully implement each strategy. And you're also going to tell us about any partners that your organization could immediately engage. So within the first 3 months or so of the grant, if you're awarded based on the existing relationships within the hotspot region. The next section is community buy-in and input. This is where you're going to describe the collaborative group that's going to support the strategies being proposed and describe what commitments the collaborative group members have made to support the work on the proposed strategies. TSET work under the Healthy Living Program, under this opportunity, under most of our funding opportunities is very collaborative. So this is an important section to pay attention to. If you're planning to use the previous grantees collaborative group, you need to say so within this section and describe any established relationships that your organization may have with that group and or its members. You also need to talk about how the collaborative group is representative of the populations that reside within the service area. If you are proposing to set up a whole new collaborative group, you are going to say so in this section, and you're going to talk about how that group is representative of the population within the service area. You will also provide a plan that discusses how new stakeholder members will be recruited to support work on the proposed strategies. In this section, this is also where there is another required attachment. This is attachment B, the collaborative group profile. So now we've got 2 required documents that we've talked about in the proposal. So please make sure that you have accessed those 2 documents, cover page and attachment B, the collaborative group profile. The next section is the sustainability plan. Because our funding is short-term and high impact and needs in the service area may remain at the end of the funding agreement, we are asking each applicant to discuss how either the entire program or one or more of the major components of the program will be sustained both financially and organizationally at the conclusion of TSET funding. So after 3 years, what's going to carry on, what's going to remain, and how is that going to remain? If you have partners that are going to be utilized to carry on the program or the strategies at the conclusion of the TSET funding, make sure that you detail that in this information. We want to see that the organizations that are applying for this have made a commitment to continuing the work even after TSET funding is no longer available. Let's see. You also have a section for appendices. This can be used to provide supplemental information that's relevant, but not necessarily essential to the proposal. So if you have data that you want to share, if you have letters of support from partners, I'll say that again, letters of support from partners, if you want to include those are much appreciated. Any policy or planning documents, or anything else that might be helpful that you want to share with reviewers, include that in the appendices. There is no page limit to appendices, but please note that we aren't looking for, this is not an avenue to circumvent page goals or page limits, but it is an opportunity to provide additional information that could be just beneficial to the proposal, but not necessarily essential. So after your appendices, you will attach your comprehensive tobacco-free policy. It is important that this is the policy that was approved by TSET during the prerequisite review process. So once you do get that policy back from me or from Kelly, letting you know that it meets our requirements, make sure that you hold on to it and that you're ready to attach it to your proposal narrative. After the tobacco-free policy is the organizational assurances checklist. This is an important document for the applicant organization to review because it lists some of the key capabilities and requirements that all awarded organizations must adhere to during the grant term. It also will contain the required certification of non-acceptance of tobacco funds attestation, which is the document that I referred to at the beginning of my slides, where the organization attests that they will not have a relationship with a tobacco organization for the duration of the agreement with TSET. So this is a requirement for all grants and contracts that TSET gives. So this document needs to be reviewed and it needs to be signed by an authorized official from your organization. This will be the last page of your proposal document that is uploaded. So it can be signed, it can be printed off and signed by hand and scanned as a flat PDF. It can be digitally signed, and either one is fine with us as long as it's signed by somebody who's authorized to enter into contracts on behalf of your organization. So that is, again, a required document. So make sure that you access that and you have that ready for your proposal submission. Again, it'll be the last page of your narrative document. So once you have compiled all of the documents for the narrative, the bulk of your proposal, the last document that you will upload is your budget. So your budget is, it is an Excel document that TSET has provided in the RFP itself. So you will not create your own budget. Please use our template. It is a required document. This has to be, it's attachment D, and this is uploaded as a separate document. We're asking that you prepare a detailed budget for the first year of the program, and then subsequent years of funding, like I mentioned, will be requested during the annual renewal process that takes place in the spring of each fiscal year. When you open the budget document, you'll notice that it has two tabs at the bottom. The first tab is for a summary budget, and the second tab is for a budget justification. When you look at the first tab, the only thing you need to worry about completing on there are the top two lines, which includes your organization name and your county to be served. All of the budget numbers on that summary document are going to pull forward from the second tab, the budget justification. The budget justification tab is where you're going to fully explain your funding request for this opportunity. You'll complete each section of the budget document, ensuring that you have provided clear and adequate justification for each of the line items. Each of the proposal or budget categories, not necessarily for each. You don't have to justify fully like each person per se, but you do need to provide an explanation of what it is that you're asking for in the personnel section above. I'm going to emphasize the justification part of the budget because it is really important that we know what it is that you're requesting, why you're requesting it, and how the funding that you're requesting supports the work it is you're proposing to do. So please don't just fill out the top parts of the budget where you are entering amounts and names or supplies or whatever. Please include information in the justification. If your program isn't requesting funding for one of the specific budget categories, such as supplies or purchase services, you can leave that section blank. Don't worry about entering zeros or NA or anything like that. As you prepare your budget, you want to make sure that you review the unallowable costs that are listed within the RFP, as well as taking a look at Appendix C, which is the budget tips and tools document. You want to make sure that anything that you're requesting in your budget aligns with TSET guidelines. And you'll also need to note that all budget requests need to be strategic, and they have to directly support the work that's being completed. All budgets are subject to negotiation and approval before, are subject to negotiation before final approval, and that there may be revisions to your submitted budget between notification of award and contract if your project is approved. So any negotiations will certainly take place, or any revisions will take place between TSET and you as a grantee. So just be aware that that is a common part of our budget process is clarifying budgets and negotiating them. Once you have your budget complete, please do save it as an editable Excel file so that it makes revisions easier during the budget clarification process. So please make sure that you save it as an goodness gracious, as an editable Excel file. So .xls or XLSX, whatever it is now. And then finally, before you submit your budget, you want to make sure that the total amount requested on the summary page matches the total amount requested on your attachment A, your TSET cover page. Make sure those two numbers match up so that we don't have any confusion about what amount it is that you are requesting. Next slide, please. Awesome. Once you have completed your narrative sections and your appendices, and you put them into a single file, and you completed and saved your budget as an Excel file, and you've checked and double checked and triple checked the application submission checklist, you're just about ready to submit. In order to submit your proposal, you'll again need to have that submission link that was sent to you by me or Kelly, TSET Grants Management. And you cannot submit, remember, you cannot submit unless your tobacco-free policy has met the requirements and you've been provided from that submission link from TSET. All proposals are due before 4 p.m. on June 6th. They will not be accepted at 4:01 p.m. They will not be accepted at 5:55 p.m. 4 o'clock is the deadline. We strongly encourage all applicants to submit well ahead of the deadline. We cannot guarantee that the two people at TSET who manage the submission are going to be available for technical assistance at 3:59 p.m. on the day of the deadline. So please submit early. I strongly encourage you to do that. If there are any bugs that you encounter as you're submitting, that gives us ample time to troubleshoot them before the deadline passes. We do have to adhere to the deadline to ensure fairness for all applicants. Just so that everybody is clear, we do go by the clocks on our agency computers, which are managed by the state. So we're not going by my iPhone or whatever my sundial says. So right now on my clock, it says it's 1:52 p.m. So please keep that in mind. 4 o'clock is the hard and fast deadline for the submission. Luckily, if you do submit early and for whatever reason you want to cancel your proposal, you can do so as long as the deadline has not passed. If you realize that you want to make a change or you left something out, all you have to do is send an email to me at tessain@tset.ok.gov. Let me know that you want to cancel, and then you can go ahead and resubmit. I'll get that email. I will cancel your initial submission, and you will be good to go. If you submit 2 proposals and you have not emailed me to say I'm resubmitting, I want to cancel my first one, then your second submission will not be considered. We can't be guessing which proposal you intended to submit, so we will go with the one that was submitted first if we have not received information stating that that proposal should be canceled. So this is important to keep in mind. We certainly allow you to resubmit, but you do have to cancel your first one first. When you do submit, there is a checkbox at the very bottom of the Smartsheet form that you fill out, and it gives you an option to send a copy of your submission to yourself. I strongly recommend that you do that so that you get a copy of everything that you submitted to TSET. Of course, if you do have any questions after you've submitted about whether we received it or not, you're welcome to email us, and I am happy to confirm that we received your submission. One important thing to note is that if you do submit and you realize that you left a document out, we're not accepting things piecemeal. So it's all or nothing when you submit your proposals. That's why it's important to know that you do need to reach out to us to cancel a full proposal submission if you did leave something out. I can't allow anybody to submit an additional document and have me upload it to your sheet because that just increases chances of error. And we, again, want to make this as fair a process as possible to everybody. slide, please. So once all proposals come in, all proposals that are deemed responsive will be reviewed according to the criteria here on the screen and the specific questions that are indicated again beginning on page 16 of the RFP. So I can't emphasize enough, please review those questions and ensure that your proposal answers them in a clear and direct manner. That'll give your proposal the best chance at receiving a high score. All proposals will be reviewed and scored based on the following areas here. So these are each of the sections of your budget, of your proposal and your budget. So your organization's background and qualifications, the region being served and the population, the strategies that you are implementing and your organization's readiness to implement them, community buy-in and input, your sustainability plan, and your budget. So as you prepare these things, again, please start on page 16 and make sure that you are answering those questions that the reviewers are going to be considering as you prepare these documents. All proposals that are reviewed will be presented to the TSET Board of Directors, and the board does make all funding decisions. So please keep that in mind. None of TSET staff are making funding decisions for you. So all funding is handled by our board. With that, that concludes the end of my slide. So I will turn it over next to Jessica Davis, our Assistant Director of Programs, to talk a little bit about the work that's going to be done under this funding opportunity. Jessica?
Thank you, Tessa. So over the next few slides, I'm going to go over some of the nuts and bolts within the RFP that have to include the service area, the comprehensive community needs assessment, as well as the strategies that were prioritized for each county. So let's unpack it. Next slide, please, for physical activity or just to be physically active in general, and access to tobacco-free environments. The initial data that was gathered during this needs assessment really helped Healthy Living Programs grantees identify priority communities, or what we term as hotspots, within the service area of the county using census tract and block group data in order to provide a granular look at health disparities and equities among the people living within this area. So one of the first things that was completed within the comprehensive community needs assessment was the identification of that hotspot region. And those regions that were prioritized and identified are featured within this table here. The selected hotspots are primarily where the work on the selected strategies will take place unless otherwise noted within the strategy. Next slide, please. So this is basically the same table. It's just continued to include Pittsburgh, Pontotoc, and Pushmataha counties. One thing you'll note is that we have some counties, such as Atoka County and Pushmataha County, that are a lot smaller than counties such as Pittsburgh County and Bryan County. So those hotspot areas, like within Pittsburgh and Bryan County, are larger than what you would see within Atoka and Pushmataha County, for example. Next slide, please. So one of the most important hyperlinks, they're all really important in this RFP, but the one that's going to take some time to unpack and review is the assessment Smartsheet within the RFP. So you'll see multiple references about the Smartsheet throughout the RFP. It is really, really important, and I highly encourage you to take the time to review the documents within the Smartsheet. There's a lot of good information, and it incorporates all of the historical work that was completed by the former Healthy Living Program grantee collaborative group, as well as the partners. These resources will really help you understand why the former grantee and partner selected the specific geographic area, and will provide details as to why the 6 strategies were prioritized and ultimately selected. Some resources within the Smartsheet include what's on the screen. We have a TSET Healthy Living Program Collaborative Group member roster, a 2020 Wellness County Profile, the 2020 Wellness County Profile Appendix, the Hotspot Region Map, Strategy Checklist, Comprehensive Community Needs Assessment Report, a survey report as well, and then the Strategy Prioritization Worksheet. So I know that's a lot of information, so I'll try to unpack it a little bit more over the next few slides. One thing I would like to note before we dive in a little bit more is that these resources that were completed by different groups of people, different staff members, and things like that. So the details within each resource will vary across counties. We did include, everybody has access to all of the documents that were completed, even if it's a county that you're not interested in. You may have kind of checked out some of the information that other counties had written. It will differ just because different people did complete this material. So that's just one thing you may have noticed if in your review or your future review of those documents. Next slide, please. So I tried to include just a snapshot of each document, and I'll go over one. I'll go over each document. So the document at the top is the TSET Healthy Living Program Collaborative Group Member Roster. So mobilization of a collaborative group is a requirement of this initiative as well, because we know it takes a group effort to make changes at the local level. We wanted to provide you all with a list of the previous collaborative group members in case you have the opportunity to mobilize the former collaborative group, or even some of the former members within that group. You yourself may have even been a member of that previous collaborative group. I see on the participant list a lot of familiar names in that list. We feel that this information is important so you can decide the best route in going about mobilizing a collaborative group for this initiative. We realize that your organization may have different partnerships in place. That is okay. So therefore, if you choose to mobilize a different collaborative group based on kind of your organization, your partnerships and things like that, that's perfectly fine. We just wanted to provide you with the resource so you know historically who was involved at the beginning of the needs assessment phase and prioritization phase. The next document on the bottom left is the Wellness County Profile. So each county has one. They basically have the same amount of information. It's just different numbers for each county. So this resource provides statewide information as well as county level data. This data was used by the Healthy Living Program grantee and partners to help determine the hotspot region. Additionally, it was used in strategy prioritization. The next document, so the one in the middle, bottom middle, is the Wellness County Profile Appendix. This is the document, I would say that this is the primary document used for the identification of the hotspot region. It does a really great job in breaking down census tract data as well as block group data. It's a wealth of information. There's really great maps that really show what the census tract looks like. I will flag that since the 2020 census occurred, what we have found that since we pulled all these documents together, some of the census tracts had changed. So these are the documents used by the former grantee. We didn't utilize the new census data track. So I'll just flag that in case you've noticed that. The next document, bottom right, is the Hotspot Region Map. So this is a really, really important document. It highlights the hotspot region. I'll go over a larger graphic in a couple more slides, and we'll unpack that a little bit more. Next slide, please. Okay, so, and then another really great document is the checklist. So this is the document snapshot at the top. So I'm gonna explain this and unpack that a little bit more. So the former Healthy Living Program grantee and partners work to identify whether or not strong policies or implementation existed within potential partner organizations or jurisdictions within each hotspot area. So for instance, we have a tobacco-free city-owned property example here. So each grantee went to all of the jurisdictions within their hotspot region to identify whether or not they had a strong tobacco-free city-owned property ordinance in place. And so they got a copy of the ordinance and really kind of looked at it to see if all of the elements aligned with our policy sample. If it did align, they would be part of what we call the numerator. And the denominator are all of the cities or towns within that hotspot region. So this one is a small one, and this one's Atoka. Atoka only has one jurisdiction within the hotspot region. So for the sake of this example, the city of Atoka has a tobacco-free city-owned property ordinance on file, but there's a lot of room for improvement, and so it wasn't included in the numerator. And then the percentage is basically how what percentage of jurisdictions are covered by a strong policy. And below that, we take into account the number of citizens that are covered by that policy, because it's really important. That's an important component as well. All right, and so going to the next document, we have at the bottom left a 2021 Community Needs Assessment Survey report. So there is a report for each county. One thing I will flag about this is the number of community members that chose to participate in this report varies across counties. So I will note that, but it does feature all of the questions that were asked and the answers provided by the citizens that responded to that county survey. So there is a breakdown of all of those demographics as well. And then in the middle document on the bottom is the Comprehensive Community Needs Assessment Report. So that is kind of really the high-level report of the needs assessment data that was collected. And so that's a really good kind of really high-level report that you can kind of review. And then lastly, I think one of the other really, really important documents is a strategy prioritization worksheet. And so those are the green boxes on the screen. And this worksheet, basically with all of the comprehensive community needs assessment data in hand, the former grantee and partners utilize this worksheet to score each strategy using 5 categories, which includes reach, so that's population reach, and that's where that checklist above the top row comes in this slide. So the population reach, the health burden within the community, the feasibility, so is this a strategy that could realistically be implemented in the service area? What we found is like there were some areas that didn't have a college within their service area that makes local policy decisions. So that's obviously something that area couldn't work on. Community said, is it a really good fit? Is the strategy in alignment with the community needs, or just an overall general good fit for the community and potential for impact? Rationale is also provided for each strategy to provide context as to why the strategies were scored the way that they were or how they were scored. And additionally, this is where the location where strategy efforts would take place. That's where that information was determined by the former partnership. I highly, highly encourage you to review all of these documents so you can better understand the historical work that took place and the foundation that was put into place for this grant. Next slide, please. So this is a larger version of the Hotspot Region Map. Pittsburgh County is one of the larger counties, so I thought this would be a good example for this presentation. There are several census tracts that were selected within Pittsburgh County, and so the areas, the census tracts that are outlined in red are the ones that are part of what we call the hotspot region. So when you see the term hotspot region, I would take a look at the map for the county in which you're interested in applying, print it off or save it somewhere, and that is what we mean by hotspot region, the areas highlighted or outlined in red. Next slide, please. All right. So this is a table that kind of features the prioritized strategies by county. Based on the overall results of the comprehensive community needs assessment strategy or comprehensive community needs assessment for each county, the applicant must choose one or more of these county-specific strategies. Each strategy includes a location where strategy implementation should take place over the course of the grant. Strategies are ranked in order from the strategies that receive the highest score in that prioritization matrix, indicating the greatest need which is option 1 in this example, through the strategies receiving the lowest score, option 6. So option 1, for example, in the TOCA tobacco-free city-owned property ordinance, that scored the highest using the prioritization matrix, whereas number 6, healthy food options and food assistance programs, scored the lowest. Doesn't mean that that's not a great strategy to select. We're just letting you know that that scored the lowest. And so in parentheses, you'll see the location in which each strategy is meant to be implemented over the course of the grant. Next slide, please. So we're moving along to Pittsburgh and Pontotoc counties. Although a single or multiple strategies may be selected, prospective grantees, again, must select within this list for the county. Please visit the assessment document Smartsheet to better understand the rationale and data that supports the selection of these strategies. Also, I really want to highlight that the strategy menu, which is within Appendix A, includes a high-level overview of each strategy and resources that will be utilized for strategy implementation. So within the strategy menu, you'll see sample activities that you would consider doing if you selected that strategy, as well as the real resources that will be used for this program. So I highly encourage, if there's particular strategies you're interested in, checking those out. Next slide, please. And we can't forget about Pushmataha County. So here are the prioritized strategies for Pushmataha County. It is important to note that we understand that each applicant organization is unique and that your organization may be better suited to work on a strategy or set of strategies that are not prioritized as the highest need on the list. Again, the first strategy in this list received the highest prioritization score. So for instance, if you're applying to serve Pushmataha County and your organization doesn't have partnerships with like some of the jurisdictions within the hotspot region or local law enforcement, you may not want to select the strategy to reduce youth access to tobacco and vaping. You may have some really fabulous partnerships within the school system. Maybe you've done some historical work within the school system. So if you choose to pick up strategy, the number 6, nutrition provisions and school wellness policies, that's great. What it really comes down to with strategy selection is choosing the strategies that are the best fit for your organization based upon your organization's historical work, your organizational capacity, and the existing partnerships that you have in place. Next slide, please. So all in all, you must select one strategy or more from the list that we were discussing in the previous slides. We will not accept strategies that are outside of the ones listed within the table, within the RFP, or the ones that in the previous slides. That will not be accepted as an option. The strategies must be implemented within the location outlined within this prioritized strategy table. It is also important to review those assessment documents, Smartsheet, as well as the strategy menu. And then the one thing that I really do want to flag is that for the youth access to tobacco strategy, that is considered one strategy that has 4 components. So the 4 components that I'm referencing are retail education, enforcement, enabling ordinance, and tobacco zoning ordinances. And so if you choose to pick up youth access to tobacco, that is one strategy that has multiple strategy components in order to ensure that it's comprehensive. And same for the farmers market strategy, that is one strategy with 2 strategy components. And then the action-oriented collaborative group under this program, an action-oriented collaborative group is required for community engagement and buy-in. Collaborative groups are meant to support community development, collaboration, community engagement, and make efficient use of resources and assets that may be limited within a proposed service area. Collaborative group members should be identified prior to the submission of this grant proposal. If possible, again, it is preferred for the applicant to reconvene the collaborative group that was previously developed by the former grantee. We did provide the roster, which we discussed earlier. However, again, your partnerships may differ from that of the previously funded organization. So if you do need to mobilize a new collaborative group, that's okay too. Or some members may have moved on, and that's okay. So we'll accept the formation of a new collaborative group or mobilization of the previous collaborative group. It's really kind of whatever matches well with your organizational needs. And collaborative group meetings must take place every other month beginning in January of 2023. And we will have meeting reports that will be due on the 10th day of the month following the collaborative group meeting. So that is a reporting component. Over the next few slides, we'll quickly go over the scope of work within the RFP. This section can be found on page 11 of the RFP. Next slide, please. The scope of work includes 5 primary components, which includes finalizing grant infrastructure components, building capacity, establishing a baseline of information on each partner organization, implementation, and evaluation. I'll go over these components in greater detail over the next few slides. Next slide. All right. So for finalizing the grant infrastructure components, this includes hiring qualified staff if they are not already employed by the applicant organization within 75 days of the contract start date. We will also have an orientation meeting, either face-to-face or virtually, with assigned TSET staff to review contractual requirements for the program. It also involves working with TSET staff to finalize the program budget and 3-year action plans. Budgets are submitted annually, and action plans will be revisited once each year to determine if action plan objectives need to be revised based on community needs and context and readiness. And then it also includes the development of a communication plan with an assigned TSET health communication consultant. Next slide, please. Building capacity includes activities such as participation in monthly virtual technical assistance visits with TSET staff, attending trainings and conducting desk research to better understand the selected tobacco physical activity and/or nutrition strategies. And by January of 2023, it would include holding that first meeting with your collaborative group that was identified within the proposal response and submitting meeting reports when those meetings take place to TSET. You also may find you need to recruit additional members to your collaborative group. So that might be an activity that you would need to engage in order to ensure that all partners are present to implement the strategy. And it would involve continuing work with existing partners and developing new partnerships to do the strategy work. Next slide, please. For each partner organization identified with each strategy, grantees will be asked to complete a checklist to establish a baseline or starting point. The purpose of the checklist is to identify if there are written policies in place or existing implementation activities in place by each partner organization. It's important to note that some strategies within the TSET strategy menu do not involve the adoption of a policy. For several strategies, only implementation activities related to practices and infrastructure will be assessed using an environmental assessment tool. So once that baseline is established, grantees would work with partners to identify ways to strengthen policy or implementation activities. Again, the strategy menu does include several of the checklists that will be used for this initiative, as well as some of those environmental assessments. So I encourage you to check those out when you have time. Next slide, please. Action plans must be approved before strategy implementation can take place. Those plans are reviewed and approved by TSET. After a policy and implementation change has been made by a partner, you'll be asked to submit updated information for each partner. So that's basically those reassessments that I discussed in the previous slide. Next slide, please. Because evaluation really helps identify gaps and successes and drives future work, the grantee must participate in all mandatory evaluation activities. including the submission of prescribed reports and other various types of information requested by TSET or TSET-funded contractors. The grantee must agree to work collaboratively with an assigned external evaluator in meeting those requirements. There are some circumstances where a grantee may choose to be part of a local evaluation that's done in collaboration with an assigned evaluator. Not every grantee may wish to take advantage of this opportunity, but it is an opportunity that is available. And then lastly, the grantee must collect all relevant process evaluation data as prescribed by TSET. So this would be inclusive of the baseline and reassessments that I discussed previously, as well as other reports to document progress. And now I am going to hand over the presentation to Kelly Parker to help start the closeout process of this workshop. Thank you.
Thanks, Jessica. My name is Kelly. Before we get started with questions, there are a few key dates. Lance, can you progress the slide? Thanks. That we'd like to bring to your attention. All of these are listed in the funding opportunity guidelines, but we wanted to highlight them and go over them with you. So the prerequisite period opened on April 15th and will close on May 25th. But as Tessa said, we highly recommend that you get those tobacco-free policies in as soon as possible for review. Questions that come to TSET during our open question and answer period will be answered on the TSET website. And the last day to submit those questions is May 27th. Proposals are due on June 6th by 4 p.m. and applicants will be notified on August 31st of the TSET Board of Directors funding decisions. Our targeted contract start date is October 1st, 2022. Next slide, and we'll go ahead and unmute everyone at this time and take any questions that you might have.
Actually, let's not unmute everybody. If you have a question, feel free to, don't just unmute if you don't have a question, please. But if you do, that's fine. I do have one question that came in that asked if this slide deck would be available after the presentation. And I believe the entire presentation is being recorded. So I don't know, but that was the question. Does anyone care to answer that question?
We were nodding, yes.
Okay, sorry, I couldn't tell. Okay, I do have, actually, this is a great way to handle this. Cam Sally has raised his hand. Please unmute yourself and ask your question.
Hello. Thank you guys for the presentation. I just had a question. If we requested for 4 strategies, is it kind of like an all or nothing scenario if we were awarded one of those 4 in terms of funding, or do we apply for just all 4 or nothing? Yeah, I think you catch what I'm trying to ask.
I'm going to punt that to Jessica, who looks like she's unmuted.
I don't know if I'm the best one to try to tackle this question, but I would definitely, if you're wanting to apply for 4 strategies, I would just make sure that you are articulating why your organization is a good fit to implement and carry out the work of those 4 strategies. I think that would be the best approach to that.
Okay, and then in terms of funding, would you accept one of those 4 strategies if we applied for 4 as opposed to? Does that make sense? I'm sorry if I'm.
Let me see if I can rephrase. I think what you're asking is if you apply for 4 strategies, is it 4 or nothing? Is that what, or would we consider?
Yeah. Or would you consider one of those 4? Yeah.
Right. That seems to be the question. I just want to make sure that was.
I honestly haven't thought about piecemealing it out in the review. And typically we look at the content as it is presented. But I think the one thing I would do in your response is to articulate, like, don't just touch on one strategy and just discuss why your organization is a good fit. It would be preferred to obviously try to package everything together nicely and fund the application as is. Tessa, I don't know if you have anything to add.
Yeah, I would echo what Jessica says. You know, if you're proposing to work in 4 strategies, then it is really important that you fully state that and show support for why your organization is capable of tackling all 4 of those strategies. It would not be now, I should also say this will require a little bit further discussion on our end after this call. This is not a question that we had thought of. But I cannot see it being either the reviewer's goal or our board's goal to kind of try to take apart proposals. It is our hope that what is submitted, it's a full package, and that's what we would move forward to the board. I don't want to say never, but that is what we intend. If you are proposing 4 would ultimately be the 4 you selected would be what is reviewed and then presented to the board. But we'll discuss it further after this and follow up as necessary. Great question.
Thanks. Thank you very much.
I also wanted to make sure before we have had a second question come in here, is that people know that all the questions asked during this Q&A session are being not only recorded as a part of this, but are being transcribed, and a full answer will appear as if you had emailed us. That way, everyone who's on this session, but everyone who reads this after will have an equal chance of hearing all questions asked and all official answers. That being said, we do have a question that's come in that says, can 2 programs share a director? Say 50% in one county and 50% in another?
Not to sound like a broken record, but this is, I think conceivably that is acceptable. We would need to have some justification in the proposal stating how that was going to work. You know, make sure that there is capacity to do that. I don't want to say definitively yes or no at this point. It would really depend on the proposal and what's presented in the proposal. When you say, Linda, director, you're talking like the program coordinator, is that correct? Not like a administrator type of person? Because an administrator, of course, is I hope you know, only part of their time anyway can be on the grant, and that goes under administrative costs. But if you're talking about
correct,
okay.
I'm talking about the coordinator.
Okay. Let's say tentatively yes, with justification in the proposal, but we'll do some further follow-up on this one too.
Thank you.
Excellent. I don't have any other questions currently in my chat space. Does anyone else have another question that you'd like to unmute and ask? I will give folks a few more minutes to go through this. I know there's been a lot of information to digest, but if it's okay, I just want to move forward to this slide. You may still ask questions, but that way everybody can begin reading on this slide as well, because it also talks about questions if you think of them after this.
Yeah, thanks, Lance. And thank you guys for your questions that had them. And if you do have any additional questions related to this RFP or the application process, you can submit those questions on our website via a web form that's located under the other funding opportunities tab. So just submit your questions via that form, and then answers to those questions will be posted on the TSET website. We didn't post any yesterday because we hadn't had any yet, but on May 11th, May 25th, and June 1st. And the last day to submit questions is May 27th of this year, obviously. But wanted to tell you too, if you're signed up to receive notifications, you should get a notification also when those are posted to the website. As Tessa said earlier, if you have any technical issues or need any technical assistance, please let her or me know as quickly as possible so that we can help you out as much as we can. Next slide.
So before we go to the next slide, I'm going to ask one final time here. Does anyone have any questions? Please do not be shy. We're happy to continue to answer questions here before we close out. I'll even smile nicely to get you to ask. So. Okay, Kelly, we'll move on to the
I
next
have one
slide.
question.
Oh, great.
Yeah, just because, you know, we have this special opportunity that TSET has provided specific to these geographic areas. Do we anticipate TSET evaluating other quadrants of the state, the panhandle, for similar opportunities, just looking at an equity lens, you know, as far as funding, as well as, you know, those demographics, those hotspots mirror many other communities and counties across the state. Just again, from an equity perspective, can we anticipate additional funds available for the other 3 quadrants in the panhandle?
I will say, I think unique about this opportunity is that we are building based on a year-long needs assessment. So this is rather unique because it doesn't even focus on the entire southeast region of the state. It just focuses on those counties where we had a previous Healthy Living Program grant, and then unfortunately they were unable to continue those services. So we wanted to really make sure that we had, since we had a really strong foundation as far as data collection, needs assessment, and strategy prioritization and planning efforts, that we kind of continue the work of those community partners. So I will just flag that this opportunity is really unique and tailored based on that specific circumstance. And Tessa, I know you had something else to say as well.
Oh, okay. Go ahead.
I don't have much else to offer. Going to echo what Jessica says. We have data that exists for this area, and so that's how this opportunity came about. I can't speak to you know, what the board might have on the docket for future funding opportunities at this time. I don't know if Thomas or Lance, you have anything.
Well, I would just add that we do have a very broad open grant category on our website right now, the TSET Discovery Grants, which are available to organizations and other entities on a statewide basis. So that is there for anyone in Oklahoma to look at and apply for.
Thank you, Thomas.
And
Okay.
as a follow-up, it says lots of the services happen statewide and needs assessments are ongoing in all of these areas. The specific counties where these needs assessments took place were the same 7 counties that are within this RFP. So Atoka, Bryan, Pittsburgh, Pontotoc, Pushmataha, and Marshall. So that is why this RFP is unique to those specific counties.
Okay, well, thank you, all of you, and for the question. Appreciate it. I think, obviously, we have the Q&A on here, how to ask other questions, how to view other proposals, including the ones that that Thomas just mentioned, and any other proposals that come along. And also from those links, you can sign up if you aren't on our list to receive anytime we release a new proposal. With that, we will, well, there we go. This is where you can sign up for those, and this is where you can ask questions if you have them. With that, I will we're right at our hour-and-a-half mark since we got started a couple minutes late. So thank you so much for everyone who attended and everyone who presented, and for all of you who are considering applying. We look forward to seeing those. Can we thank you, and we'll stop recording now.